Important topics from MSN Medicine are anemia, polycythemia, bleeding disorders, clotting factor defects, thalassemia, leukemia, lymphomas, myeloma, disorders of thyroid, parathyroid, adrenal pituitary gland, hypo tumors, diabetes mellitus, orthopedic modalities, cast, splint, traction, crutch walking, arthritis, rehabilitation, prosthesis, gas gangrene, meningitis, TB, glaucoma, cataract, Meniere's disease, epistaxis, laryngeal obstruction, nephritis, nephrotic syndrome, acute renal failure, benign prostate hypertrophy, head injuries, spinal cord injuries, quadriplegia, hemiplegia, paraplegia, increased ICP, stroke, Bell's palsy, trigeminal neuralgia, Alzheimer's, Parkinson's, Guillain-Barré syndrome, multiple sclerosis, myasthenia gravis, HIV, fluid and electrolyte imbalances, GI bleeding, peptic and duodenal ulcer, appendicitis, hernia, pancreatitis, cholecystitis, hepatitis, liver cirrhosis and failure, ECG and arrhythmias, heart blocks, CAD, angina, MI, cardiac tamponade, endocarditis, heart failure, shock, RHD, Raynaud's disease, aneurysm, PVDs, MSN, surgery, breast cancer, screening, BSE, staging, gynecomastia, fibroadenoma, lymphedema, thyroid cancer, pheochromocytoma, GERD, Barrett's oesophagus, diverticulitis, CA colon rectum. Surgical safety checklist, IV lines, patient position, OT position, cautery images, suture and knots, surgical site, infection its prevention, types of wound, nutrition, NG tube, central lines, how to do, enteral nutrition, complication, enteral parenteral nutrition, basics of trauma management, ATLS, BLS, GCs, Glasgow Coma Scale, abdominal trauma, thoracic, trauma, tension, pneumothorax, burns, fluid management, types of burn, care of burn, wound, principle of plastic, surgery, skin graft and Humby's knife bed sore, various types of dressing, basics of wound healing, keloid and hypertrophic, scar, liver abscess, liver cancer, gallbladder stones, various presentation and investigation, pancreas, pancreatitis, and Whipple surgery, renal stone, horse, shoe kidney, bladder cancer, urethral trauma, hypospadiases, ectopia, vesicae, undescended testis, torsion skin cancer, DVT its prevention causes, of post-operative fever, osteomyelitis, osteoporosis, rickets, osteomalacia, fracture healing anesthesia, instruments, basics, of ventilator triage, disaster management, nursing foundation infection control and prevention, code of ethics clean and safe patient care, nursing process plus health assessment tool, blood sampling, blood transfusion, IV fluids, vital sign oral care, unconscious patient, urinary catheterization, laurigation, catheter care suctioning, oxygen therapy, airway management, basic and advanced airway, care of patient with CVP line of cannulation, medication administration, drug calculation, adult pediatric, burn calculation, NG tube feeding, CPR, bandaging, care of pressure, ulcer, care of surgical drains, care of patient with chest tube drains, blood transfusion, positioning perioperative nursing assessment scale, enema, ostomies, chest tube drainage, liver biopsy care, paracentesis, tracheostomy, lumbar puncture, intubation, acid-base imbalances, mental health nursing defense mechanisms, lithium, antidepressants, antipsychotic, schizophrenia, bipolar disorder, depression, intellectual disability, dissociation eating disorder, alcohol and opioid use and withdrawal, types of phobia, depressive and aggressive patients, ECT, substance abuse, OCD, eating disorders, delirium and dementia, CBT, narcissistic, histrionic, schizotypical personality, terminology, pharmacology, anticonvulsant, anticoagulant, antihypertensive, bronchodilators, anticholinergic, cholinergics, digoxin, diuretics, corticosteroids, opoids, NSAIDs, antidotes, toxicology, community health nursing vaccine, route of vaccine cold chain, ANC guidelines, fertility indicators, family planning methods, diarrhea and its management, child growth, ICDS nutrition guidelines. For pregnant, lactating females, mosquito, ticks, mites, louse. Identifying features, prevention NTEP, NACP, NLEP, TB shell, leprosy programs, malaria, vector-borne diseases, investigation, prevention, rickettsial diseases, epidemiological study, designs national health mission, ASHA, Anganwadi, functions management, mumps, measles, rubella, chickenpox, smallpox, plague, daily nutritional requirement, sterilization and disinfection, staining viruses, rabies, polio, HIV, amoebiasis, staining, Grams, ZN Albert, sterilization indicators, Lyme disease. Pediatrics development milestones, difference BW growth and development, Down syndrome, bronchitis, croup, pneumonia, CV stick fibrosis, normal vitals of newborn, Ballard score, APGAR score, NRP, neonatal resuscitation protocol, neonatal jaundice, cephalhematoma and caput succedaneum, fetal circulation, Natus criteria, shape of heart in different conditions, tetralogy of Fallot neural tube defect, diarrhea, pica nephrotic syndrome, Klinefelter's, Turner's, PKU, and alkaptonuria, gynecology obstetric score, calculation of EDD, antenatal care, anemia in pregnancy, anemia, Mukt Bharat program, abortion, MTP, ectopic pregnancy, MGT, molar pregnancy, and MGT, chorionic villi sampling, amniocentesis, cord prolapse, shoulder dystocia, MGT, PPH, MGT, and risk factors, active, MIGI, of third stage, labor, partogram and labor care, antepartum, hemorrhagic placenta, previa and abruptio placenta, placenta, accreta types, breech maneuvers, Leopold maneuver, fetal skull diameters, instruments for D, and curettage and cesarean section. Episiotomy, diabetes in pregnancy, MGSO4 and antihypertensives in pregnancy, dose of anti-D and indications, twins types, superfec unfetation and superfetation, vaginitis PID syndromic, MGT of PID and vaginitis, emergency contraception, CUT, OCP, MALA D and MALA N, absolute contraindications, vasectomy and tubectomy, pap smear, HPV, vaccine, ovarian tumors, markers, semen analysis.